The number of diabetic children is on the rise, with 1,600 cases diagnosed, translating to 3.5% annually in the country. Despite the disease being associated mainly with adults, more than 25,000 children are living with diabetes in the country, according to reports by the World Health Organization, with many of the children diagnosed with diabetes type 1.
For a while now, diabetes has been associated with the elderly, but this is no longer the case. At least 3.5% of children in the country are now being diagnosed with diabetes type 1 annually. According to statistics by World Health Organization, 2 million people have diabetes in the country. 95% of these are adults. However, the number of children being diagnosed with diabetes is on the rise. Most diabetic children in the country have diabetes type 1, which results from the destruction of insulin-producing cells in the pancreas.
1 diabetes is not a disease of lifestyle. It is a condition that actually affects, a condition that affects the pancreas and destroys it. So there's some insult to the pancreas that is thought sometimes, is it viral? Was there something the child was exposed to early in the developmental stages? But it is not influenced really by what a child eats. It's not the mistake of a mother or a father or even the child's. It's just a medical condition. Okay. When the pancreas gets destroyed, then these children need insulin for life.
Diabetes type 1 is a chronic condition in which the pancreas produces little or no insulin. It typically appears in adolescence. Symptoms include increased thirst, frequent urination, hunger, fatigue, and blurred vision. The causes of this remains unknown. Treatment with insulin is required for survival.
Type 1 diabetes, like I said, is a condition that destroys the pancreatic cells completely. It can only be managed with insulin. There is no other medication for type 1 diabetes. The children must be on insulin, usually more than 2 to 3 injections per day, and they must be on it for life. If they do not have insulin, they will die.
Report by World Health Organization estimates that the prevalence of diabetes in the country at 3.3% and predicts a rise to 4.5% by 2025. However, 2/3 of diabetics may be undiagnosed. Diabetes require long-term follow-up with uninterrupted access to medication and specialist care, a requisite requirement which is impeded by lack of adequate knowledge and training of health workers. Uncontrolled diabetes has dire consequences for health and well-being, including the possibility of heart attack, stroke, blindness, kidney failure, and in other scenarios, leading to leg amputation. Linus Moshigadi for your health.
Fantastic report there by Linus Moshigadi, but equally very troubling that there could be 3.5% of the young population diagnosed with diabetes. But yet again, this is the information that is not out there in public, or perhaps there's still a lot of ignorance around the same subject, because the always question that you hear when you hear that a 9-year-old or 10-year-old has been diagnosed with diabetes, you ask why? How? Those are the questions we want to address, and misconceptions around the subject of diabetes. And you have Eva Muchemi with us in studio. She is the Executive Director, Kenya Diabetes Management Center. Thank you very much, Eva, for joining us tonight.
Thank you.
First of all, let's begin from the aspect of you're passionate. You've done this for 18 years.
Yes.
Passionate about the war on diabetes. Why so?
Thank you, Kioria.
Yeah.
My interest, my passion is because we had my father who was diagnosed with diabetes through complications. Yeah. He was already blind in one eye, and the other one was 50%. His heart was already affected, kidneys. Basically, his body was in problems. And 7 years later, he died. By the time our father died, he had already been to ICU, and in all that time and the time he was in hospital 3 times, we'd incurred a bill of 3 million, and we even had taken a bank overdraft to pay for the doctors, for the ICU, for the hospital admissions, and the 24 care from a nurse aide. So I do know, and a lot of us who are associated with diabetes and even other NCDs like cancer and heart problems, I do know that diabetes is a source of poverty also, because we were able to raise a little money, but we could not even raise the whole of it, and our family is big. So we had to call for help. And that's how
your passion was cultivated.
That's how my passion was created. By the time our mother got diabetes 18 years ago, we already knew with the first symptom, we'd already been checked ourselves for diabetes. So when my mother got diabetes, we already knew what to do. She'd already come for education. We knew that education, in the correct information, is what the Kenyan people had to get, and get it early, and remind people about that basic information that we used to have in class 1. Prevention is better than cure, which at that point we didn't know, but we knew exactly what that meant with our father. Our mother is almost 90 now, going to 90, and she doesn't have a single complication. Why? Because we already had the correct information, having seen.
And you used it as a point of reference to treat your mother. But let's get to the scary statistics as painted by Linus Moshigadi in that particular story. Children, 1,600 cases of being diagnosed with diabetes type 1. First of all, tell us what diabetes type 1 is, because by all essence, people think when it is diabetes, and particularly for children, they'll just say, this is high sugar levels. And the question they ask, my child is not even taking sugar, and issues like that. And those are the misconceptions out there.
Yes, there are many myths and misconceptions about diabetes. The first one is that even as the cases of the children, the type 1, and the younger people, adolescents, start going up, we are still stuck to the idea that diabetes is for old people and for the wealthy, the older wealthy. And so even when the children display symptoms, for those who know the symptoms, we do not think about diabetes. In the health facilities, it's very rare to find even the professional healthcare providers who will think first about diabetes, screen for diabetes. You'll be checked for malaria, you'll be checked for anything else. And that is also the case with my father. He had tests for typhoid, malaria, everything like that. And so the kids, what we are doing, and we have a program, a national program we do with the Ministry of Health, the counties now, and the World Diabetes Foundation. We are training the healthcare professionals to tell them the numbers of young people with diabetes, the number of young children and adolescents being affected by diabetes type 1. It is increasing.
Sorry to cut you short, Eva, but I would want to know what is type 1 diabetes, and why should a child be predisposed to type 1 diabetes?
Okay, now, as I had explained, I am not a medical person, but I have been there long enough to know what type 1 means and that. And there are 3 main types of diabetes. There are others that don't have a lot of people. Type 1, which affects the young, like those young children we are talking about, adolescents, and usually comes before people are 30 years old. So we are talking about quite a young age. Then we have the type 2, that comes...
That type 1 is where you would have to inject yourself with insulin?
Yes, they inject themselves every day, or they are injected if there is an age that cannot inject themselves. And this, if they do not inject themselves, the survival rate, according to the International Diabetes Federation, is 1 year. That child will die, as sure as day follows night, if you do not have the insulin. 1 year for that child. And so that is type 1. And so insulin is a life-saving drug. That's what we are saying and advocating. And saying they must be given that drug. Then there is a type 2, like I said, is the older people. And this one is mainly associated with the lifestyle. We are not eating right. We are eating unhealthy foods, a lot of refined sugars, deep fried foods. We don't get into physical activity. So those things of lifestyle. So we need to take care of our lifestyle for type 2. Then the third one one of the three main is what is called gestational diabetes mellitus. And this is when women are pregnant, just because of the hormonal changes in the body, when they get pregnant, then there is a fight with the hormones that are taking care of the baby, and the insulin, the amount of insulin that is the pancreas has to produce, and so they get diabetes. And what we are seeing also today is that there are a lot of women in that category, and I'll keep referring to International Diabetes Federation, which is IDF. The figures that were there in the 8th Atlas edition that came out in December 2017, 1 out of every 6 pregnant women has gestational diabetes.
And that's scary
That's
too.
scary. So even when we talk about child mortality, let's not just think about diarrhea and the other conditions that affect small babies. Let's also think about that child who is being born by a mother who has already diabetes in pregnancy.
It drives me to the other question that I wanted to ask, because assuming this child is diagnosed at the age of 12, or even 10, because we have seen such cases with type 1 diabetes, what mechanisms are there put by government or private players to ensure that, one, the burden on the parent is lessened? Because I'm assuming if this child has to depend on insulin every single day of their life, it actually is a big financial burden on a parent.
It is a very big financial burden, and that's why we are talking about advocacy for these children to be given insulin for now, just like we give medicines for HIV because they are life-saving drugs, or malaria or TB. So insulin should be put in that category also, because it's a life-saving drug. But having said that, there is a program that is called Changing Diabetes in Children. And it's been going on. We've been running it with the Ministry of Health. Now the counties, some of the, what we call the hubs, are in the counties and Novo Nordisk. But these are only 17 hubs. 17 health facilities, they are the only ones. That figure you saw there, 1,600, is only from 17 facilities, health facilities in the country. So all the other facilities, we need to know how many of these young people with type 1 do they have in their facilities. And that is the work that we're trying to do in the Changing Diabetes in Children. Changing Diabetes in Children, like the DMI Center, which is the Kenya Diabetes, we call it a DMI Center. We have 439 children right now who are coming for insulin from Novo Nordisk and Roche at no cost. It's not free insulin. It's insulin at no cost from Novo. And those other facilities, and we keep telling the other facilities, please, if you have a child, and that's not Nairobi, that's Kakamega, that's Nyeri, Embu, Coast, all those hospitals, and they are spokes. They have spokes, what were called maybe the district hospitals. And we keep saying, enroll those children. Let us have them. But we are also talking to NHIF and telling them, don't wait for these kids to get sick. Why don't you do the prevention bit also as NHIF? Government, why can't we get into awareness what diabetes is? And let us look at those women. If the women who are pregnant have diabetes, it's a risk factor.
Because we will talk, as we wind up, we will talk about, the advocacy aspect in terms of where the government is, because this is still, even as President Uhuru Kenyatta talks about universal health care in one of his big four agendas, the issues of advocacy, particularly on this disease, is not well catered for. But in the meantime, you say there's diabetes type 1, and there's also gestational diabetes, and then there's type this one 2. Associated with lifestyle. Which is the most, or which is the common diabetes amongst Kenyan citizens? The most common, and because of the numbers, it is type 2. That in globally, I mean, it is 85% of the people with diabetes, and that is the 452 today globally are the ones with type 2,
And then the other 15% is made up of type 1, 5 to 10%. And then you have the gestational diabetes, about 5. And then the other ones that are diabetes that are not major, they make the other a small percentage. So our advocacy is about, let us do prevention, let us raise the awareness, let the counties join with the national government, let even the private companies, universal health coverage. That's what we are talking about. Let the people with non-communicable diseases be treated, be looked after, be given facilities for treatment, just like we have in communicable disease. Let's not have a budget that is 100 times over for communicable diseases, and the non-communicable diseases has hardly anything you can talk about.
All right, tell me something, Eva. Assuming that the level of diabetes or the type of diabetes you have is largely associated to perhaps your family or it's genetical, is there hope for a person like that?
Yes, there is hope. Even when you have a genetic predisposition, like the Dr. Nancy Kunyiha we talked before we started, even when you have genetic, even when you have other risk factors, it is not that you must get diabetes. Take care of those modifiable factors, like weight, like physical activity, like eating healthy. Those are modifiable. There are others, after 40, there is nothing you can do. If you have genetic predisposition, there is nothing you can do because you have the gene. But you can take care of those risk factors that you, yourself, can take care of. And so what we are saying is, let's go out there in the community. We've been out there in the community with Safaricom Foundation, with the Association of Insurers of Kenya, with many, many corporate bodies to try and talk to people, do medical camps. And in those medical camps, raise awareness and tell people, one, seek answers for prevention. Don't wait to find that you're feeling sick. Go and get checked. The diabetes screening test is only 5 seconds.
Very short. We have done it in this studio before.
Good.
It's a very short process.
Yes.
But obviously that is the aspect of advocacy that we had promised to talk about.
Yes.
But as we wind up, lastly,
yes,
this gestational diabetes.
Yes.
A pregnant woman has been found with gestational diabetes. Is there a mechanism to follow up on the child so that they are not exposed? Because already by the fact that the mother has diabetes, though gestational, the child is at risk. Is there a follow-up mechanism so that this child is not exposed?
It is to follow. It is to make sure that when they go for antenatal, and even when they are bigger, the mother and the child are being followed. Even for the mother, if she's not followed, in 5 to 15 years, she will have developed type 2 diabetes. So that's and a lot of women, nobody tells them they have diabetes in pregnancy. So we want also to say that at 24 weeks of pregnancy, all the pregnant women should have a blood sugar test. So
at 24 weeks?
At 24 weeks. So that it can be picked up.
That should be about 6 months?
Not quite. It's lesser than, it's about maybe 4 months. Then they continue getting followed up. Then they get continuous follow-up. Even after that, they'll be told. But you'd see, you need that information. You need to be told. You need to be told that that child also needs to be followed up because due to that, there is a risk factor that they can get diabetes later. But we need that information out there to the community. We need that correct information, not the myths and not the misinformation that is out there. Yes.
That's, that ball is in the court of CS Cecily Karaoke, the Cabinet Secretary for Health, but most importantly, again, even the citizens and players, public-private partnerships that will ensure that our people are very much aware about diabetes and the risks involved. Thank you very much, Eva, for joining us tonight, and your contribution very much appreciated. We can only hope that we shall escalate this conversation further to ensure that we rid the country
Thank you.